following yesterday's positive case in Northland. I want to start by giving an overall summary, and then I'll give you the latest information from the Pullman Hotel, where we know the case was staying. The Director General is going to provide details on testing and contact tracing and a few more specific details around the case. The case has now been given confirmed status. It was a probable case yesterday. It is now a confirmed case. We know that the person's husband and hairdresser have tested negative, which I outlined this morning. That's a very encouraging development. We can also confirm that the strain of infection is the South African variant, and the source of infection is highly likely to be a fellow returnee during the person's stay at the Pullman Hotel. Again, this is good news because it means we know where the source of infection is and we don't have to divert our scientists and health experts from other COVID-related work in order to identify that source. We know that from the genome sequencing that was completed overnight, and I want to recognise the amazing and the fast work done by our scientists to turn that around so quickly. That is a very quick result for the genome sequencing, and it has made a big difference. The two people occupied rooms in close proximity to each other on the same floor of the Pullman Hotel, and I'm advised by officials that they are confident that the infection was a direct one and that there is no other missing link in between those two people. We don't know exactly how the infection took place at this point, and investigations on that are continuing. That includes looking at CCTV footage from the Pullman Hotel to identify when and where they may have come into contact with one another. It will also, the review so far has confirmed what we said yesterday, that the case, the Northland case, has adhered to infection control guidelines in her room and in the exercise space as we have asked her to do. So again, I want to thank her for her diligence. Everything that we have seen so far suggests that she has done all of the right things. It has been decided this morning to delay the release of people who were due to complete their isolation at the Pullman today. There are 46 people who are affected by that decision. That can be managed within our contingency. They will be staying a little bit longer. An update from the Ministry of Health on that can be expected later on this afternoon, including an indication of when they are likely to be released. They will receive an extra test prior to their departure as an added precautionary measure. Of the 253 returnees who have exited the Pullman Hotel within the new infection window, based on the information that we now know, 172 of those had been contacted as of 8 a.m. this morning, and work has been continuing through the morning, and it will continue through today to make sure that we are contacting all of those people. We're advising that those guests who exited managed isolation at the Pullman Hotel between the 9th of January and the 24th of January self-isolate immediately. They should contact Healthline to arrange a test, and they should remain in self-isolation until they get a negative test result. Of the approximately 220 staff who work at the Pullman Hotel, 114 of those have already been tested this week. The remainder of them will be tested later on this afternoon. I'm advised that those tests will be completed by 4 o'clock. Therefore, we should have the results of those early tomorrow. We already have some of the strongest infection prevention and control measures in place in our isolation and quarantine facilities, amongst the strongest anywhere in the world. And we do monthly audits of those to make sure that we're keeping them up to date and to identify where they can continue to be improved. However, as is normal in a situation like this, an investigation is being carried out urgently to look again at whether there are any further changes that might need to be made. Officials are already getting more information based on the genomic testing, which will help us to determine how the infection occurred, what we can learn from it, and particularly in light of the new variants that we're dealing with around the rest of the world. That will also include looking at whether returnee movement should be restricted towards the end of their stay in managed isolation after they've had their final test and before they have been released. Work has already started, as I indicated this morning, on the installation of new filtration devices to the air conditioning systems in our managed isolation facilities. Before I hand over to Dr. Bloomfield for more information, I do want to reiterate a few key public health messages. While officials are working as fast as they can, there are things that every New Zealander can continue to do to help. Get a test if you are feeling unwell and isolate until you get the result of that. Please do not go to work or out in public if you are feeling unwell. Scan everywhere you go, switch on Bluetooth. I'm advised that there has been a surge in people switching on Bluetooth in the last 24 hours. And wash your hands regularly. Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. Just before I provide further details on the case, I'd like to also confirm that there are 6 additional managed isolation cases to report today, and the details of those will be in our media release. So contact tracing on the case that we're calling the Northland Case, January Northland Case, has identified 15 people who are being treated as close contacts. The reason this number has gone up is that there are 13 of them who are in 2 retail settings, and it's not immediately clear which of these people served the case, and so all are being treated as if they are close contacts. That's why that has gone up from yesterday. All have been contacted, are self-isolating and have been tested. So far we know that the woman's 2 closest contacts have returned negative tests, which is encouraging. As the Minister has said, the results of the whole genome sequencing confirmed she has this, what is known as South African variant. It was a variant first identified in South Africa, known as the B.1.351. Now, we're continuing to monitor advice from the WHO on this variant and all other new variants that are identified. However, there's limited epidemiological data available to date on it. What we know so far is that it may be more transmissible, but that's not as clear as the information about the variant first identified in the UK. There are no indications to date for any differences in disease severity or in incubation period. There's some evidence that this variant may evade some aspects of the body's immune response, but obviously it's very early and we will be watching closely just to see, as will other countries, what this means. Now, new forms or variants of the virus have become increasingly common around the world. The key point here is they are now global. They are not confined to specific countries. And we have expected to see them in New Zealand. One of the things we do here is, of course, we do whole genome sequencing on every positive case we get here. So we have a very good data bank of our variants that we've seen in New Zealand. So further on contact tracing, just to talk a little bit more about the cases movements around the community in Northland, I do want to acknowledge, among other things, her frequent use of the NZ COVID Tracer app, scanning QR codes and having Bluetooth turned on. As we've now published on our website, last evening the list of 30 locations of interest was put up, and it's the use of the app by this person that has enabled us to follow up quickly anyone who may have had contact with her and to head off any further potential spread. We do this as a precaution in situations like this, and I can't thank the person enough for her dedicated use of the app. Remember, this could be anyone at any time, and it's up to all of us to help protect each other. The message here is clear. Everyone on the team needs to scan QR codes and enable Bluetooth on phones and on the app. And pleasingly, an extra 200,000 people turned on the Bluetooth functionality on the app yesterday, and I encourage those who haven't done that to do so, and of course to everybody to not only have the app on their phone but to use it assiduously. Last night, as many locations of interest as possible under the time constraints were contacted to alert them that they would be listed as a potential exposure event. We were not able to get through to all of them, and so by yesterday evening we made the call to publish the list of those sites and to send out a push notification to people who had been there. We've also published on our website the potential exposure date and timeframes, and in some cases this is just a 5 or 10 minute period. So when people call Healthline, we want them to be mindful of the date and time of exposure for that location. We need to ensure that our testing stations are testing as a priority those people who were there at those time and dates, not people who may have been there at another time or who are just worried. of course, anyone who is symptomatic should go and get a test and isolate until they get the results. Push notifications, as I said, have been sent to app users, and the Bluetooth, those who had Bluetooth turned on and may have been identified as being in proximity for a period of time to the case have now been sent a notification as well. And what I can say is there were 162 push notifications to people through the app who had scanned in at the same time into those locations that the case was at. A word on testing centres. There are now 17 additional centres up and going across Northland and Auckland metro region. There is high demand. As I said earlier, we want the people who were at those places at the same time and date to be prioritised for testing. There are a lot of people turning up in Northland who are neither symptomatic nor were at the places. Can I ask those people to stand back and ensure that those who are the priority to be tested first? There is community testing in a range of places around Northland, and those are on the DHB's website, and likewise the Auckland locations are on the Auckland Regional Public Health website. By 11 a.m. this morning, nearly 1,000 people had been tested across the Auckland region. For comparison, at the same time last Monday, that was just over 200. So it's great to see the response. We do want to ensure it is the right people being tested. Remember, as the Minister said, if you are symptomatic, the important thing is to stay home and get a test. Just a reminder that healthcare facilities across Northland remain open. I understand that there are people who are not turning up for appointments at the hospital because they may be concerned. There is no increased risk in going and attending a medical or other appointment at the hospital or anywhere else, and please do get care in a timely way. And finally, the number of tests. Yesterday was 2,678, and quite clearly we expect that number to be much higher today. Thank you, Minister.
Thank you, Dr. Bloomfield. Before I open up for questions, I do want to return to something that has been a bit of a recurring theme in our COVID-19 response, and you will have heard me talk about it here before, and that is the need for accurate information to reach the New Zealand public. I was made aware last night that circulating on social media were a number of Facebook infographics purporting to announce a lockdown for New Zealand commencing from today. I do want to reiterate that that's fake, that is not true, and that people should refrain from sharing information unless they can verify that it is true. The potential for sharing that sort of information can actually do harm, and so I would just encourage everybody once again to make sure that if you're sharing something on social media, please make sure that it is true. I'll open up. Jess.
There are lots of people sitting in lines in Northland at the moment, perhaps some of them watching this briefing on their phones. What's your message to them who they may have been waiting for hours to get a test?
My message to them is if they're showing symptoms or they have been asked to get a test, please do make sure you're getting a test. But I'll ask Dr. Bloomfield to comment on that as well.
Just to add to that, and I endorse what the Minister said, there will be waits in some places. There is a lot of testing available around the community. We have seen this before, and we want people to be tested. We want to ensure the right people are tested because that's how we will confirm that there is no onward community transmission. It's important that it is prioritised for those people who need the testing.
You said there were 15 stations, so has that been scaled up this afternoon, and how are you pumping in more staff from around New Zealand to support them?
So the staff are from around the northern region, both in Auckland and also from Mangawhai North in Northland. They do have surge staff that they, as DHBs, they are able to add in. So they have increased both the locations and the hours and the number of staff there. So people who are waiting, please be patient. You will get a test. If you're not in one of those categories, it's a priority. I'd ask you perhaps stand down and ensure that those people who are a priority do get tested.
Specifically doing in Whangarei though, because we've had people who've been waiting there since before 9 a.m, no toilet facilities, no food or water available, and they've been waiting. What are you doing in Whangarei?
I have a list, and it is on the website, of course, of the District Health Board and also Auckland Regional Public Health of the places where people can be tested. However, there is always a big increase in volume and an interest in testing when this happens, so people need to be patient, and if they do have to wait, it's a good idea that they do take some food and water and expect to wait.
Have you spoken to local iwi about a response plan should this go out into the community?
No, I have not. I have not personally done that yet. I know that my colleagues, my parliamentary colleagues, Kelvin Davis and Willow Jean Prime, have both been in contact and have been putting out their feelers and keeping in contact with their local communities, as have other members of Parliament from both sides of the House I've been in contact with. So I know that they are up there keeping in contact with their local community members. I also know that the local public health teams do have an outreach program, and I'll ask the Director General to comment on those.
Yeah, the public health units are in direct contact with obviously Māori health providers, and they'll be assisting with some of the testing. And also the All of Government team reached out to the Iwi Leaders Forum yesterday before even the announcements were made, just to make sure they were in the picture, and they've been kept informed throughout.
Minister, you talked about restricting some of the returnee movements after their final test before they leave MIQ. What would that look like?
Look, that's something that I'm getting some further advice on. So it is something that we are looking at, whether or not, and it's still an open question, whether or not that would be an additional layer of protection after people have had their final test while they're waiting for that test result, just to ensure that there isn't any risk of them picking it up in the meantime.
Will you be toughening up MIQ
I'll come to Audrey over here and then I'll come back.
Did someone with the South African variant, were they there at the same time as her? Like, you know, weren't they shifted to Jet Park?
They were, so they arrived in and they tested positive. They arrived in just before the day 0 testing requirement was introduced. They tested positive on day 3, so they were moved as soon as the positive test result came back.
And their day 3 coincided with her day what?
That was her second to last day. So the person who is the case that our Northland case appears to be infected from arrived on the 9th, and day 3 testing was the 12th, confirmed on the 13th, and moved to Jet Park, and that was the day that our Northland case left. Late in the day, left the managed isolation facility.
And is it possible, like you said, you think it'll be direct contact? Do you mean, could it possibly just be a surface area? Would that be included in your definition of direct?
So by direct contact, the Minister was implying that it's an interaction between the two directly, rather than an intermediary person, because the genome sequence is identical. So that suggests it's a direct interaction. However, the mode of transmission we are looking into, and that could be through respiratory droplet, it could be through air transmission, so aerosol, and that includes potentially ventilation, and we'll be looking at that, or it could be so-called fomite transmission, so a surface. And we're looking at CCTV footage, and both cases are being thoroughly questioned just to see whether there may have been any interaction between them.
Can you elaborate on what you said, Minister, about air conditioning?
Yeah, so we had conversations about this late last year, and I actually just received the confirmation earlier late last week, if you like, that work is now underway in terms of looking at installing additional filtration systems on air conditioning units in our managed isolation facilities. Depending on the assessment of each of those facilities, the air conditioning systems in each are different, and so just depending on what the need would be there, we would look at that. But I'll ask the Director General to comment.
The only thing I would add is that we will be expediting an assessment, working with the Pullman to look at the ventilation system there to just see if it may have played a role in this case.
Would it be normal for that floor in the Pullman to all be sharing the same air in the same system?
Look, I can't answer that question specifically, but what I can say is one of the criteria that is used in selecting hotels suitable for managed isolation in the first place is the nature of their ventilation and air circulation systems.
You are able to get in touch with some of the business owners in Northland. Some of them have said they haven't had any contact from the Ministry of Health at all. What would you say to those concerned business owners?
I think we had this conversation yesterday where there was some pressure to release the list more quickly. We do take a reasonable period of time to endeavour to get in contact with people who QR code scanning and businesses and QR code scanning has identified as being a potential risk area, but we have to draw a line on that somewhere, and we do need to get that information out to the public, which we did last night. That was published around 7:30 last night. Obviously, Public Health continue to work with those businesses and other entities that are in that group to advise them on what the appropriate public health measures may be to make sure that they're keeping themselves and others safe. So my message to them is keep talking to public health officials about what the most appropriate course of action for them to do is. We'll come back over here. I promised you'd come back over here, but...
Will you be toughening up MIQ restrictions for those coming back from high-risk countries? For example, not leaving their room or introducing rapid testing?
Well, you'll see that we've already made some changes just in the last few weeks, which now means that people are getting their day, they're getting tested as soon as they arrive. They are having to isolate in their rooms. They're not allowed out of their rooms whilst they await those testing results. The issue that we're now considering is whether there needs to be something at the end of their stay as well, just to add that extra layer of certainty. So we will... We'll be getting advice on that.
What about when they leave MIQ? Would you suggest anything like another week in self-isolation just to be extra careful?
Again, that was something that we did review late last year. The advice that I received was that wouldn't be justified. Now, I think if you look at the situation that we're dealing with here, it is highly unlikely that it was extra long incubation period, which would mean that an extension of the length of time isn't necessarily going to do anything to reduce the overall risk profile that we face.
And would you temporarily close the border to high-risk countries such as you did for China last year?
Look, we can't do that on an ongoing basis. Ultimately, we do have a responsibility to allow New Zealanders a safe passage home. That's what our managed isolation facilities are designed to do. There are already quite strict, if you like, limits on the number of people that we can bring in at any given time. People are waiting a long time to get home. Whilst we have an emergency allocation, that is very, very heavily subscribed. A lot of applications get declined for that because it's very, very tightly, the criteria for that are very, very tight. But we do have to provide that opportunity for New Zealanders to come home.
This individual wasn't tested for 7 days after first getting symptoms. Does this mean potentially it has spread more widely?
Look, I'll ask the Director General to comment on that. We've not yet seen any evidence of that. The fact that the person's close contacts, the results we've had so far are negative, as I've said, encouraging. But at this point in proceedings, you can never say never, and so there's still information we don't yet know. But
just a comment to add to that. Yes, so the testing was a wee way down the track, and my Chief Science Advisor, Dr. Ian Town, suggested that one reason why this person hasn't infected her close contacts, and one of whom she spent a lot of time with, her partner, may be because the CT value in her test was quite high, and also she didn't talk about respiratory symptoms. It was more muscle aches and so on, so she may not have been sort of sharing or spreading the virus much. So that's encouraging. But of course what we want to rule out is any potential people who may have been infected from when she left managed isolation right through to when she went into self-isolation, and that's why we've put the word out.
And what day did health officials actually call to check on the woman after she left managed isolation, and did they actually extract all that crucial information at the time as she would have already been unwell?
So she was called on the 16th is my understanding, so it was the third day after she left, and I don't have the detail, but just a brief comment from one of my team yesterday was that she had definitely been called and didn't report any symptoms at that point.
I'll come back to Jess.
Shane Retty raised a point this morning saying that there hasn't been an identification of where the woman actually was tested. Will we know that information, and was that testing station open today?
Actually, that was one of the 30 locations that was put up on the website, was the community-based assessment centre where she was tested, is my understanding.
So when was that put up, that information?
Last evening.
And sorry, which centre is it? I'm sorry, I think there just is a little bit of confusion about which one it is.
I don't know off the top of my head, but we can come back to you on that with the exact one.
Okay.
We'll come down here, Luke.
Dr. Bloomfield, just you mentioned there that the person involved had more aches and pains rather than coughing and spluttering much. Is that, of what we know of the South African variant, is that in line with that variant, or does that just seem to be a peculiarity of her particular case?
Look, different people report different symptoms, and we know muscle aches and pains, those sort of that classic flu type myalgia, as we call it. Plus, she did have what she reported as sort of chills as it got worse, and she had a mild fever, but she didn't really report respiratory symptoms, runny nose or a cough. So I don't think that's peculiar to this variant. It was just how the illness expressed in this person. And of course, what we also know is that some people are infected and don't display any symptoms at all.
Okay, we'll come back here.
We've spoken to businesses who, as of this morning, had been visited and still hadn't been contacted by MOH. What's your advice to them? That should they be closing and doing a deep clean?
Well, they should, if they haven't been contacted, then they should call the public health unit to get advice, remembering that we've gone very wide with all of these locations that the person's visited, and the fact there were 30, which is many more than we've had in any prior cases, has meant it has taken time to get through them all. If they want advice about whether they need to take precautions around closing and deep cleaning, the public health unit will be able to support them with that.
Minister, on Cabinet tomorrow, first Cabinet meeting of the year, is this sort of top of the agenda, and are you taking any decisions to Cabinet tomorrow that will be the next steps of the response?
I think it'd be fair to say that COVID-19 has been a topic of discussion at almost every Cabinet meeting over the last 12 months or so, and it was already on the agenda for our discussions tomorrow for the first Cabinet of the year. Initially, we were intending to spend a lot of, most of, I guess, our focus tomorrow was going to be on vaccines, and we're intending to talk about that in the post-Cabinet press conference tomorrow afternoon. But of course, we will be having a bit of a debrief on this particular case as well.
Does that include things like, for example, last year it was flagged masks potentially mandate across the country? Is that something that on public transport, is that something that you'd talk about tomorrow?
Look, we always keep all of those things under review, and I don't want to preempt the conversations that we might have tomorrow, but yes, we're always checking in on where our overall COVID-19 response is at, what parts of our response might dial up, which parts of it we might want to alter.
On the fake infographics that you mentioned, what's your message to those behind those infographics, the ones making it?
Look, I think people shouldn't underestimate the potential for fake news like that to do real harm. It causes undue anxiety. It can have consequences for individual families if they alter their plans and make decisions based on the fact that they think there might be a lockdown when there's not going to be one. So, please to everybody, just make sure that what you're sharing, and it's good that people share news about COVID-19, but just make sure it's verifiable news and it's true and accurate.
Just quickly at this point, in Northland, obviously Waitangi takes place in about 2 weeks' time. At this point, is everything still on? Politicians will still go to Waitangi?
At this point, yes. I haven't seen anything that might change that.
What contingencies are there in place for Northland should there be an outbreak?
Look, the same as for the rest of the country. We do have your resurgence plans, and you'll be aware that we've talked through those here. Just towards the end of last year, we went through what might happen in the event of a resurgence. We are not at that point at this stage. At this stage, we're still dealing with a case, and we're still working very, very hard to identify the contacts and to isolate that case so that we don't need to go through that. But we are ready if we do need to.
You described the Northland case as pretty meticulous during her time in managed isolation. So what questions does that raise in regards to someone who might not have been as compliant with the rules while they were there?
Look, I hope it's a reminder to all New Zealanders that we're not asking you to do this just because it's a fun thing to do. There's a real public health need to record your movements using the COVID Tracer app. It's secure, it's private, it's your information, but it does make an enormous difference. Turning on Bluetooth and scanning, those two things go hand in hand, so it's not one or the other. But as this particular case has shown, it means that we can get ahead of any potential outbreak. And you'll see from the various incidents that we've had to respond to over the last 6 months or so, that taking the August outbreak aside, actually our contact tracing system has helped us to avoid having to have any further restrictive measures put in place.
But looking specifically in the managed isolation and quarantine, if she was very careful while she was in there and she was, still picked up COVID-19, what does that mean for someone who's a little more careless if it hasn't gone through, say, the ventilation systems?
Yeah, look, the feedback that I have had is that people who leave managed isolation, having done 2 weeks of time, are actually quite aware of themselves. People in this room and around the country will remember what it felt like when we went from level 4 and level 3, where we were at home for periods of time, how that felt when we came back out into the community. I think all of us, for a period of time, were ultra aware of our movements, and generally speaking, the feedback that I've had is that people who have gone through managed isolation are very much in that zone. But obviously, I think what I've foreshadowed is that we're looking again at just that end of stay protocol and whether there are any further changes that might be made there. Audrey?
Is it more than likely Dr. Bloomfield, that people who have a positive test on day 14 actually caught it in MIQ?
One of the things we've been doing now for a couple of months is routinely investigating any person who is infected or who gets a positive test in a managed isolation facility who returned a negative test on day 0 and or day 3. Because what we want to rule out is whether there has been transmission inside the facility. So we've been doing that routinely, and I get an update every week on where every single one of those cases has been looked at, and we rule out with a view to ruling out in-facility transmission. Many of them are historical cases. We're finding now, and some we've found it was transmission in flight, and we've been able to identify that, and we've published on that. But this is a classic example where we have seen someone with who has returned a test actually post release from managed isolation, and there are others who we've also found just over the last few days who've tested positive late in their stay, and we will be doing a thorough investigation to find out, again, just to get to the bottom of how did that happen, where did it happen, is there a gap, what do we need to do to close that gap?
Will you publish that data about the people who test positive, late in the piece? I don't mean this is rare, clearly, yes. But quite a few are testing positive at day 12, aren't they?
Yes, so what we have routinely done is we publish the day that someone tests positive, and what we can start to do is what we're looking at is also, there's a question about whether we should be including historical cases in our numbers. Most other countries don't do that, and we will see an increasing number of people. They're not acute cases, and so we're going to look at our protocols to see, first of all, should we be including those in our numbers that we report to WHO, and secondly, yes, to see if we can provide regular information on just what we think is the reason behind those late infections.
The Ministry of Health did publish late last year a study on in-flight transmission and what we've learned about in-flight transmission, and that was one of the pieces of advice that we considered when we were considering pre-departure testing and the extra layer of protection that may add. We know more about in-transit and in-flight transmission now than we did 4 or 5 months ago, and that study, it's a relatively short study, it's a good read, and it does give people a bit more of an insight into what we now know about that we didn't know previously.
Can you rule out any mingling among the returnees at this point in time, especially those past those 12-day tests?
Look, haven't seen any evidence of that so far. In this particular case, as I've said, the review so far has highlighted what we've said yesterday, which was this person appears to have done everything right, and it appears to have been incredibly conscientious about following the rules, about maintaining a distance, about wearing their mask when they needed to. All of the things that we were asking them to do, evidence so far suggests that they have done it. But that's one of the things that the investigation process works its way through in very great detail.
Will you be reviewing as well alert levels tomorrow at Cabinet, and if so, what factors are going to come into play with that?
No, I have not indicated to the Prime Minister that I think that's necessary at this point.
You mentioned that there have been 200,000 people turning on the Bluetooth function in the last 24 hours. Do you have data on the number of QR scans in the last 24 hours?
I don't have them, but we can certainly probably get you that information. I don't think I got it before the briefing today.
Obviously, when there's a community case, there's usually a big jump in vigilance, and then it trails off. Do we need to be doing more than reminding people to be vigilant? For example, getting businesses to not serve people unless they've scanned? A couple of sort of reminders here. One is, I would say to all businesses, please have a look at your QR codes. Some of them are looking pretty tatty now and actually get quite hard to scan if they've been, on the outside of the shop for a period of time. They actually get to the point where it's quite difficult to scan them, and I've seen people giving up on trying to scan QR codes that are difficult. Put them in a way that's easy to access. Sometimes if they're behind a double glazed window, it can again be quite difficult to scan them, so please make sure they're easily accessible. Preferably have fresh QR codes up in a number of different places that makes them very easy to access, so you don't get people lining up one behind each other, trying to scan. These are all things that businesses can do that will actually be very helpful in encouraging people to scan. I think one of the things that discourages people from scanning is if they try and it doesn't work. So fresh QR codes, now's a good time to refresh those. If you're in hospitality and you are showing someone to a table,
ask them if they scanned their code on the way in. When someone's paying at the counter for something, ask them, did you remember to scan on the way in? These are things that add no extra time or effort to businesses, but actually, again, make a difference to promoting the scanning culture that we're going to need for the next little while in order to keep, to really remain vigilant.
The Kapiti District Mayor says he's concerned there's not enough testing centres available in his area. Some people are having to drive up to 45 minutes. Are you going to ramp up the number of testing centres in that district?
So I think as the Director General's just outlined, we have actually already been ramping up just in the last 24 hours the number of testing sites that are available. We'll continue to look at areas where there's more demand and so on. Obviously, we don't have an unlimited capacity, but I do want to acknowledge that the 4 district health boards in the Upper North Island have been working incredibly constructively together to help each other out where they need to, and I'm sure that that's going to continue.
Advice we be giving.
We'll come over it.
Where was the genome testing done?
It was done here at ESR in Wellington, and they sent through the results at 12:33 this morning.
I mean, last time there was a community outbreak, you were talking about getting quicker results by setting up Auckland to do the testing. Has that happened yet?
Yes, actually the Auckland laboratory can do it, and also the standing up facility in Christchurch. There was a reason why it couldn't be done in Auckland yesterday, but to be honest, the timeframes in terms of transporting the sample from Auckland to Wellington didn't hinder our ability to get that rapid testing. And again, just as the Minister said, it's a testament to the science team at ESR, remembering that the team here in Wellington is the one that has done all the genome sequencing today, and they were to date, and they were able to do it rapidly as they did last time.
But I want to point out at this point, I've looked at this pretty closely, because obviously anything that takes a period of time adds a level of frustration, and I have now been convinced, having spoken to a number of scientists who are not involved in this process about it, that the scientists are moving about as fast as they can. So it's not a logistics challenge, it's a science challenge. It just takes that long to actually do it.
With this case at the doorstep of Ngāpi, what advice will you be giving Ngāpi and the wider Northland iwi ahead of Waitangi Day?
Look, at this point, I have yet to see any evidence that suggests that Waitangi events will be disrupted. And I'm feeling a bit more optimistic about that today than yesterday. But we're still in the early stages of this, and I do want to reiterate that people should stay vigilant. Please keep doing all of the right things. I guess what I would say, though, is that those who are organising events around Waitangi, please follow all those public health measures that we ask people to put in place when they're doing a big event. Make sure you've got QR codes up everywhere. Make sure you've got hand sanitising stations around the place. Make sure that you are, encouraging people not to come if they're at all unwell. Do all of those things that we would ask anyone organising a larger event anywhere around the country to do. That's a really important thing, and it's just a reminder to stay vigilant and stay prepared about that. But again, I'll ask the Director General if he wants to add to that.
The only thing I would add is that we have got a group of senior officials that's already gathered from across the organisations at central government, and they'll be reaching out on a more than daily basis to work with Ngāpui and other. I think Ngāti Whātua is the iwi that is hosting the Waitangi celebrations this year as well, so they're working closely with them.
Right, I'll do one more brief sweep of the room. So we'll start over here and we'll work our way to the right.
Australia's just approved the Pfizer vaccine. Does that mean New Zealand will be following closely in its footsteps?
Look, New Zealand and Australia's vaccine approvals processes are actually quite closely linked, and we'll have a bit more to say about that tomorrow. As I indicated, Cabinet's talking about that tomorrow, and the Prime Minister and I will both be here tomorrow afternoon, and we'll have a bit more to say about that then.
In terms of timing, when are we going to get the exact picture of how this is played out? Is it tomorrow's testing, or is it Wednesday's testing? You know how it was always that, was it 48 hours that we get the true picture of how widespread it is?
I mean, I guess what I'm going to be looking for is how many tests have been done of those potential contacts in the next sort of 24-hour period, and what do those results show us. But again, I'll ask the Director General to comment on that. I'm not sure there's a hard and fast rule here, though.
So those 15 close contacts, when do we get the results back?
So the initial results from them we should have back later today. What we're really interested in, because those people are in isolation, of course, while they're being tested, we're just interested in all those others who may have been at those venues, so that community testing, and really it's over the next 24, 48 hours. If we can get as many of those people tested as possible, then, and that those tests come back negative, and all those tests that are done that are part of what we call sort of follow-up or surveillance from this case, they have a special code, so the laboratories know to expedite the reporting of them, and so within 48 hours we'll have a good idea of whether or not there's been any further spread.
One more front.
What impact could this have on a potential travel bubble with the Pacific?
Look, nothing to add on that at this point. At the moment, our plans there remain as they have been.
In MIQ, are people from the same flights restricted to certain floors, or are people from all different flights scattered all across certain rooms on certain floors?
What we do try and do, or what the people who are managing our managed isolation facilities do try and do, is keep people from the same plane, roughly, in the same vicinity. That's not always completely possible, but that's what they try and do. And then once they're in the facility, they try and keep them apart from one another, unless they're in the same, say, family unit within that. So they really, once people are in managed isolation, the goal is to try and keep them apart from everybody else, even if they had been on the same flight.
Introducing measures though to make sure they stay in a more confined area?
Look, we've been doing that all along, and you'll see that every so often there have been extra changes there, including things like the smoking areas have been physically altered so that people who are going to a smoking area for a cigarette are now actually physically kept separate from anyone else in those smoking areas. All of those things are under constant review just to see if there's anything else we can tighten up there.
Just on the vaccine stuff, you said that we could expect something tomorrow, so we could see an approval announcement tomorrow?
No, you wouldn't see an approval announcement tomorrow, but we'll be able to update you on the timetable for that.
And you just mentioned how you were more optimistic now, 24 hours on. Are things looking up with this Northland case?
Look, it's looking. Well, what I would say, I don't want a crystal ball gaze. There's still a lot of information that we're going to need here. But what I would say is that the woman concerned doing all of the right things has certainly given us a good head start.
Bloomfield, just a quick question from a colleague. On the times that have been given for the locations of interest, many of them overlap with each other. Just to clarify, is that like a general sort of timestamp for the times that she was at those different locations?
That's right, it's general, and we of course scan in, but we don't scan out. So the best measure we have of when someone may have been in a venue is when they scan into the next venue. So we tend to take a sort of a liberal approach at the other end of the time period.
Okay.
Just to be clear, what is your leading theory as to how this woman has contracted COVID-19 while in managed isolation?
Well, the leading theory is that it's cross-contamination between two different people, one of whom arrived several days after, sometime after her. Exactly how that took place, as the Director General's outlined, we will continue to investigate to identify a likely theory.
So it could be a lift button, could be the ventilation.
Exactly, there's any number of possibilities. Richard, you get the last question.
Well, it's already been asked. It was about bubbles.
Right, great. All right, thank you very much, everybody.